Kia hora te marino, kia whakapapa pounamu te moana, hei huarahi mā tātou I te rangi nei. Aroha atu, aroha mai, tātou I a tātou katoa. Well, morena koutou, and welcome to this Now We Are 12 webinar on material hardship and housing and homelessness in young people, being hosted by the Growing Up in New Zealand study. Ko Sarah Jane tēnei. My name is Sarah Jane and I'm the Research Director for Growing Up in New Zealand, and it's my pleasure to be facilitating this webinar today. We've got a wonderful lineup of presenters and panelists for you, colleagues who've been involved with Growing Up for a long time and who really believe in the vision of Aotearoa being the best place in the world for tamariki, rangatahi and their whānau. This morning we have two presentations for you from members of our research team who will take you through our recent work looking into young people's experiences of material hardship and housing and homelessness at 12 years of age. We're then going to bring together our panel to have a conversation about what we can all do as researchers, policymakers and advocates to support young people to live flourishing lives. We have a team here in the background who are keeping an eye on the Zoom. So if you have any questions about our papers or for our speakers, please use the Q&A function. Before I hand over to our first speaker, I want to give you a little bit of context. Many of you will know that Growing Up in New Zealand is Aotearoa's largest contemporary longitudinal study of child and youth wellbeing. Participants in our study were recruited in 2009 and 2010 during pregnancy, and the team have been following this cohort since this time to understand what we can all do to support children and young people to live and to be well. The work you're going to hear about today comes from the 12-year data collection wave, which started in the second half of 2021, just after the Omicron outbreak sent us all into a level 4 lockdown. Despite the challenges this environment presented for many of us, we are proud to have completed online interviews with 4,500 young people who reflect the expansive ethnic and gender identities of 12-year-olds living in Aotearoa today. So with that in mind, it's my pleasure to introduce our two speakers for this morning. First, we have Molly Grant, who is a research assistant with Growing Up in New Zealand and a PhD candidate at the Faculty of Education, Community and Social Work here at Waipapa Taumaterau, University of Auckland. Our second speaker is Associate Professor Kate Prickett, who is a named investigator with Growing Up and Director of the Roy Mackenzie Centre for the Study of Families and Children at Victoria University, Wellington. Thank you both for your time this morning, and Molly, I'll hand it over to you.
Kia ora, Sarah Jane. Tēnā koutou katoa, ko Molly Grant tōku ingoa no whanganui tāra aho. It's my pleasure to present the findings on behalf of the Growing Up in New Zealand team today relating to material hardship. Since the Growing Up in New Zealand study has tracked the children in the cohort from before they were born right through to early adolescence, we were really interested in building a picture of what material hardship looked like for the cohort across the childhood years. And so today I'm going to be sharing just a few of the findings from the wider material hardship report. And these are going to focus on young people's experiences of material hardship at 12 years of age, and also look at the patterns of material hardship across the childhood years from birth through to early adolescence. And so when we're talking about material hardship, what we're really referring to is the basic needs that families are having to go without because of financial restrictions, but that really all families should have access to here in Aotearoa, New Zealand. And so those are things like not being able to afford fresh fruit and vegetables, having to put up with being cold in the wintertime, and maybe having to borrow money from friends and families just to cover those basic costs. And so the first insight I want to share with you today is that we saw that 1 in 10 of the Growing Up in New Zealand cohort were living in households reporting material hardship at age 12. We used the DAP17 index, which many of you are probably familiar with, and this is a measure of hardship that allowed us to group the young people in the cohort into these 3 different groups that you'll see in this table here. So our first group, we have what we've labelled no or little material hardship. And this describes around 90% of the cohort who were experiencing either no material hardships at all or just a few material hardships at the 12-year time point. Next, we have our material hardship and severe material hardship groups, and that makes up the 1 in 10 of the Growing Up in New Zealand cohort who were reporting material hardship at age 12. And what the day-to-day realities look like for these families in hardship is that for the families in material hardship, around 60% of them couldn't afford an unexpected cost of $500 if that was to arise. Over half of these families felt very limited in the money that they had available to buy clothes and shoes, and around 64% had to cut back on local trips to keep costs down. Then for our families living in severe material hardship, we see that around 70% of them couldn't pay their utility bills, 62% went without fresh fruit and vegetables, and around 42% did not have 2 pairs of shoes that were suitable for their day-to-day activities. We were then really interested to look at if specific groups of young people within our cohort were more likely to be affected by hardship. Unfortunately, we saw that who experiences material hardship is not random, and that when young people were living in households that were either single parent households, were lower income households, or if the young people themselves identified as either Māori and or Pacific ethnicity, then these young people were more likely to live in homes with material hardship. And so I'll provide an example looking at ethnicity. The figure here on the left shows that across each of our major ethnic groups, that the vast majority of young people within each of these groups were not living in material hardship at age 12. However, when we look at our Māori and Pacific young people, we can see that much higher proportions of these young people are living in material hardship or severe material hardship, particularly when we contrast that to our sole European families. We took this information and looked at it in a slightly different way. And so the second figure on the right shows our 3 different material hardship groups. And we can see that in our no or little material hardship group, around 50% of the young people that fall into this group identify as sole European. And so this means that the only ethnic group that these young people were identifying as was that European group. However, the story changes quite a lot when we look at our material hardship and severe material hardship groups. We see that the majority of young people in both of these groups are identifying as Māori and or Pacific. And so what these 2 graphs together show us is that although many of our young people are not experiencing material hardship, that there are some stark inequities in how material hardship is patterned across different demographic groups, and that there really are some fundamental inequalities within the systems and structures here in Aotearoa, New Zealand. If we move now from looking just at the 12-year time point, we now have information in the Growing Up in New Zealand study on material circumstances at 5 different time points across childhood. And so what we did is that we, for each of these different time points that you'll see here, we categorized the young people as either living in material hardship or not living in material hardship at each of these different time points. And this allowed us to look at what material hardship looks like for the cohort across the whole of the childhood. And so where I said before that 1 in 10 of the young people were living in material hardship at age 12, what we're seeing is that when we look across all of childhood, that actually 1 in 5 of the children experienced at least 1 instance of material hardship by the time they turned 12. We were also interested in seeing at what particular ages and stages these young people were experiencing hardship within their childhood. And so we saw that around 3/4 or 75% of the young people who experienced hardship at some point in their life so far experienced that before they started school. So this means that before the cohort turned 5, those children who were going to be exposed to some form of hardship throughout their childhood 75% of them experienced that within before they turned 5. But we also saw that a lot of the cohort were experiencing material hardship at those later 2 time points as well. So that's the 8-year and the 12-year time point. And around 56% of those who were going to experience hardship did so in those middle childhood to early adolescent time points as well. From here, we were interested in looking at the patterns of material hardship or the trajectories of material hardship across childhood. And so what we did was we identified the most common patterns of material hardship across childhood. And what we found was that actually material hardship was quite varied. We weren't sure, would we see a lot of variation in the material hardship circumstances, or would we see that material hardship is quite stable? And so we did actually see quite a lot of variation. So although many of the children did experience hardship at some point in their childhood, being persistently in hardship across the childhood years was quite uncommon. And so I'll just talk you through those 4 kind of most common trajectories that we observed. Our first group we've labelled not a material hardship, and this describes around 78% of the cohort who were not classed as living in material hardship at any of those 5 time points. Our second most common trajectory we've called some exposure to hardship, and this describes around 15% of the cohort who had 1 but often 2 time points where they were living in hardship. The good news for this group is that most of the young people had transitioned out of hardship at that 12-year time point. Our third most common trajectory we've labelled increasing hardship, and this describes a small portion of our cohort who, during their early childhood, they had some point where they were not living in hardship, but by that early adolescent time point, that 12-year time point, all of them were living in material hardship. And actually, we saw that the most of these young people were transitioning into hardship at the 8-year time point, and then all of them had transitioned into living in hardship at age 12. Our fourth most common trajectory that we observed, we've labelled persistent hardship, and this describes children who experienced hardship at either all 5 time points or 4 out of 5 of the time points across childhood. So what if we look at all these trajectories together, what we can see is that hardship is transitory, that there is a lot of movement for our cohort in and out of material hardship across the childhood years. In terms of policy relevance for these findings, I won't talk too much to this because we do have the experts on our panel joining us later who will respond to these findings from a policy perspective. But I do want to reiterate that most of the 12-year-olds in our cohort were not living in material hardship at age 12, but we did see that 1 in 10 of the cohort were experiencing material hardship. 1 in 5 experienced hardship at some point in their childhood, with the majority moving in and out of hardship across time. 75% of the children who were exposed to hardship in their childhood did so or were exposed before they started school. And also many of our families, around 56% of those who experienced hardship at some point, did so in those middle childhood to early adolescent time points. That concludes the material hardship section of the webinar. If you are interested in exploring these findings in more detail, please do visit our website, the Growing Up in New Zealand website. The full report is available for download. But now I will hand over to Kate Prickett, who will present on the housing and homelessness findings.
Excellent. Thank you so much, Molly. Tēnā koutou katoa, ko Kate Prickett aho from Victoria University. Thank you all for being here at the start of your workday. It's lovely to see so many of you online. Before we get started, I'd like to quickly mention my co-authors here, Hakan Lai, who's the lead author of this brief on housing and homelessness, along with co-authors Anna Ranka-Darby, Sarah Jane Payne, who you heard from earlier, and then Polly Atataka, who you will hear from shortly on the panel. So for this particular brief, we had 2 main questions that we sought to address. The first one was examining the quality of young people's housing at that 12-year wave. So this included things like dampness and mold, heating and insulation, keeping the house cool during the summer, but also instances of homelessness and severe deprivation. And we wanted to understand how these conditions differed by tenure type, so whether families owned their home or not, and by ethnicity and by families' material hardship, which is a nice transition from Molly's presentation here. And for our second question, we really wanted to leverage the really rich longitudinal data that we have in growing up in New Zealand to look at young people's experiences of residential mobility or instability from birth through to this 12-year wave. Right, we know that New Zealand families have some of the highest rates of residential mobility among all developed nations. Right, so if we're looking at these patterns in a longitudinal framework, we can look at inequities in the ways that children are experiencing this residential mobility and hopefully shed some light on how to solve these inequities and also the potential consequences for longer term children's health and well-being. Right, and I want to stress here that this is a massive brief, and that the data that we have on housing, both in the brief and also in our growing up in New Zealand data sets, extends far beyond what we're showing you here today. Right, so I highly encourage you to go and check out that brief. All right, so jumping right in here, the main finding is that a majority of our young people in Aotearoa, New Zealand, are living in safe and secure housing, right, across a wide range of indicators that we were examining. However, there are some stark inequities when we look at housing conditions by home ownership and by ethnicity. So as an example here on this first chart, you'll see that that light blue part of the bar is showing you the proportion of young people who have living in homes that have problems with dampness or mold at that 12-year wave, right? And here you can see that this differed across household tenure. Right, so 30% of children, again, are living in a home with problems with dampness or mold. But when we look at children who are living in public housing, this is 57% of our young people. For those in private rentals, that's 42% of our young people, while it's around a quarter of those who are living in a home that their family own. Now, we also see inequities by ethnicity, but these inequities are not as large as what we see with household tenure. Pacific young people were most likely to be living in homes that had a dampness or mold problem, around 43% of this group, whereas 38% of our rangatahi Māori were living in homes that had dampness or mold problems. And this is compared to 24% of Asian and European Pākehā young people. Now, these two charts that we're showing you here, we put them together because these two things are obviously linked, right? Part of these ethnic inequities that we are seeing are really due to also young people's household tenure, right? So we also know that at age 12, rangatahi Māori and Pacific young people were far more likely to be living in public housing than were Asian and European or Pākehā young people. So for the first time, we asked the primary caregiver during the interviews about their experiences of severe housing deprivation and homelessness. And we asked them about experiences of severe housing deprivation from between the 8-year wave and when we interviewed them at the 12-year wave. Now, this question is very explicit in terms of asking families whether they lived in any of the following living situations, and they're given a list. And these are things such as living on the street, in a car, or a shelter or motel. And we explicitly asked them because they had nowhere else to go or to live. So overall, what we found was that 7% of our young people had experienced at least one instance of severe housing deprivation between the 8-year wave and when they were interviewed at the 12-year wave. Now, when you look among that 7%, the most common experience for those families, which was over 90% of them, said that they had to move in with friends or family because they had nowhere else to live. Right, this was followed by around 15% of families who said that they spent some time living in motels. And again, that's 15% of that 7% who experienced homelessness. A further 9% said that they had experienced living on the street or in a car or in someone's garage. Right, so this chart here is showing you the proportion of young people who experienced homelessness, again by household tenure at the 8-year wave. So that was their living situation 8 years. Did they then go on to experience severe housing deprivation by the time that they were age 12? And what we found here again is inequities by household tenure. So close to 1/4 of our young people who are living in public housing at the 8-year wave went on to experience at least one episode of homelessness by the time they were 12 years old. This was followed by 9% of young people who were living in a private rental and about 4% of our young people in homes that their family owned. I do want to be very clear here that being in public housing does not cause you to become homeless at a greater rate, right? On average, we know that these families are more likely to be experiencing other types of challenges that are also associated with high residential mobility, right? So that's like having lower incomes, experiencing more hardship, and other mental health and disability challenges, right? Things that we know that are prioritized in terms of the way that they receive public housing in the first place. And we're very lucky today that we have Miranda Devlin from the Ministry of Housing and Urban Development, and I'm sure she will be able to speak far more in depth on these issues for us and unpack some of this. And then again, we also have inequities by ethnicity and the experience of homelessness. Again, some of these differences will be driven by differences in housing tenure. So what we found is that rangatahi Māori were 4 times more likely, and Pacific young people 5 times more likely than Pākehā European children to experience homelessness. Right, as I mentioned earlier, we also examined patterns of residential mobility, and this is across the entire early to middle childhood life course. Now, other research has shown that frequent moves like these are so negatively correlated with young people's outcomes because they have a destabilizing effect, right? Such as being disconnected from their communities, from their schools, from their GP provider, but also because they're just disruptive of the home context that they're living in more generally, right? So this chart here is showing the proportion of young people who experience a particular number of moves between study waves. So as an example, on the right-hand side here, on the far right-hand side, you'll see 56% of young people did not move houses between 8 and 12 years, whereas that little gray box that says 8.5, that's showing us that 8.5% of young people had 3 or more moves from the 8-year interview to when we saw them again at 12-year interview. In the actual brief, which I encourage you to look at, we explore these trends further, not just looking at it by age, but by looking at it within child across their life course. And what we find from doing that type of analysis is that around 31% of our cohort either never moved since they were born or moved maybe just once or twice over that time period. But we do have this group of 6% of young people who consistently, each one of those waves, were moving at least 3 times between the waves. Right, so what's it telling us is that we have about 6% of our cohort who are moving every year at least once or maybe twice every year from the time that they're born to the time that they're 12 years old. Right. Finally, I talked about how lots of frequent residential mobility may not be great for children, but it's also likely that different types of moves have different types of either benefits or consequences for children, right? They're not all equal. It could be that some moves might be good, right? Like moving from a house that has a mold problem to one that is dry and warm, or moving closer to work or school so you can better balance your work-family life. But there may be other types of moves that could be incredibly disruptive, right? And they could result in poor housing, such as your landlord deciding to sell a property or you're splitting up with your partner, right? So if families and growing up in New Zealand indicated to us that they had had a residential move, we then followed up and asked them about the reasons for their move or for the most recent move. And then we asked them, of those reasons, what was the most important one? So a team of growing up in New Zealand researchers then used this information to classify the different reasons into whether they were called what we call involuntary moves or improvement moves or some other type of moves, right? And what we're interested in with involuntary moves are things where families have less agency over that move. And so we consider that to be more disruptive if they're not having as much of a choice in those moves. Right, so overall, the main driver of those involuntary moves seemed to be that the house that they were living in was sold by their landlord. That was around 42% of those involuntary moves. A further 27% of people who experienced involuntary moves was due to a breakdown in a partnership, and 16% for financial reasons, usually around a change in their financial circumstances, which made it no longer able to afford the place they were living in. Right. And again, here on the right-hand side, you can see these types of moves broken down by a measure here. We're using NZ DEP. Now, NZ DEP is a measure of deprivation in neighborhood, right? So in the first quartile here are those young people who are living in neighbourhoods with the lowest levels of deprivation in New Zealand. And then in quintile 5, you have young people who are living in what was considered the highest deprivation level neighbourhoods in New Zealand. Now, as you can see in the lowest quintile, around 12% of the moves that happened in that quintile were involuntary moves, right? As you go to higher deprivation levels, you see that the involuntary moves becomes a larger proportion of the types of moves happening. And so you're almost 3 times as likely to experience an involuntary move if you're living in one of those high deprivation neighborhoods. And I'd like to say that this pattern of findings that we have here is really similar if we were to look at families' own material hardship levels. So what can these findings then tell us about how best to support young people and families in Aotearoa? Well, we know that a majority of young people are now living in homes that don't have those major problems like dampness and mold, but we still see these really stark inequities in those experiences. Right, so this tells us that we need to continue to push on these housing quality improvements, such as following through and enforcing those healthy home standards. Homelessness is of great concern in New Zealand, especially now that we're in the midst of the cost of living crisis. The data that we collected for year 12 was collected prior to some of the larger or broader inflationary pressures that our economy is experiencing, right? So this means that it's going to continue to make it hard for families to stay in the secure and remain in safe and affordable housing. So in this respect, there are shelf-ready plans that are being implemented, such as the Aotearoa New Zealand Homeless Action Plan. And these things focus on both the prevention side, but also a strong focus on the supply side issues for helping our families in these most precarious positions. And then our findings again also highlighted that we have these high rates of residential mobility among New Zealand young people. And some young people in our study were experiencing moves almost every single year since they were born. Right, again, this highlights the importance of policies that protect our renters, such as those recent changes that we've had to the Residential Tenancies Act. Right, this act included, among other things, prohibiting landlords from terminating tenancy agreements without specified reasons, and also limiting rent increases to once a year. Right, so things that stabilize a rental environment for people who are renting homes. But again, these issues of housing that we've just been talking about are very much tied to the aspects of material hardship that you heard about earlier. Right, so this also means, again, that ensuring that families have incomes that meet their everyday needs is really essential for making sure that they can afford to live both in safe, high quality homes and not be forced to move. Right, so with that, I will turn you all back over to Sarah Jane to get the fun part started.
Elder Kate, and thank you, Molly and Kate, for your excellent work and great presentations today. It was a really nice reminder to the audience that behind these presentations sit very interesting papers and briefs that are available on our website, and a lot more detail and nuance, I think, that might help with some of the questions that are coming through on the Q&A function. So we'll keep going through the Q&A. And perhaps save a couple for later on in the webinar if we have time. But right now, what I want to be able to do is introduce our panelists for this morning. First, we have Dr. Hugh Webb, who is a principal analyst working in the Child Wellbeing and Poverty Reduction Group within the Department of the Prime Minister and Cabinet. Hugh's responsibilities include advising government on child poverty policy, monitoring and reporting issues related to the Child Poverty Reduction Act 2018. Hugh has a PhD in psychology from the Australian National University and has spent more than 15 years working in social policy and research here in Aotearoa and in Australia. Our second panelist this morning is Miranda Devlin, who is a senior advisor in the Impacts and Evaluation team at Te Papa Kurakainga, the Ministry of Housing and Urban Development. Miranda has worked in the housing-related data, research and evaluation space for about 6.5 years and has spent a lot of that time walking alongside the Growing Up in New Zealand study as part of the Policy Forum and contributing to work which has been funded through the Children and Families Research Fund. Finally, we have Associate Professor Polly Atatoa, who is a public health physician and Associate Professor at Te Nera, the Institute for Population Research at the University of Waikato, and a founding investigator with the Growing Up in New Zealand study. Polly's research and clinical practice focuses on the broader determinants of population health and wellbeing equity, particularly for tamariki and rangatahi within the context of whānau and community. And so I just want to thank everyone for being here today and being open to engaging with the data and insights that have been shared by Molly and Kate this morning. And so I just want to open up the conversation, and I wonder if we might start with you, Miranda, and just ask, maybe you'd like to share, was there one thing that surprised you or maybe inspired you from the papers, and particularly your interest in housing?
There's so much to comment on. Firstly, kia ora koutou, and thank you for having me here today. I guess a lot of the not so great figures are things that are not, not new to me, in terms of that working in this space. A lot of the figures aren't great and haven't been great for the time that I've been working in this space. But it's still a shock to see those figures there in terms of Māori and Pacific whānau particularly. We know they're disproportionately affected by this housing crisis, and there's no greater example than the figure in there. So yeah, I think that's not a nice thing to see, and it's really important therefore that we have our Māori housing strategy, Mahi Ka Ora, and our Pacific housing strategy, Whale Mo Ainga. I did see some rays of light in the figures as I went through the report, some little positive stories there that we can't read too much into, but they are encouraging. And those were things like the fact that if I've got the figures, if I've calculated right, about half of those experiencing severe housing deprivation were experiencing little to no hardship at the 12-year data collection wave. So hopefully there's been some good wraparound support there that have supported those whānau when they've needed it. Things like the slight decline in residential mobility from 8 to 12 years, regardless of the cause. There could have been many causes for this, but it's still positive, and hopefully we'll see other data sources start to reflect that kind of change as well, with the changes to the Residential Tenancies Act. I've got lots of little positive things, but I'll let some others comment, and I can say some more if you like.
Miranda. And I agree with you. I actually think it's really important that whilst there might be a level of familiarity in the data that we've shared today to other work in other spaces, I think it is really important that we are always shocked, because it means we are always remembering that having access to good quality, safe housing for young people is a right. And so when we see inequities patterned in these ways, we should be shocked. And I think that helps us to be motivated to work harder and to think about solutions. So I might come back to you shortly to understand whether or not there might be some exemplars, or whether or not you know of some areas where success has been shown in policy and interventions that you are aware of. But Polly, Kilda, I wonder, I know you've been doing a lot of research in this area, but you also work with a lot of community organisations and NGOs. So I wonder for you how these papers reflect what you see in your work in the community, and are you shocked or inspired by the research we've seen today?
Tēnei tamahi ki a koe, Sarah Jane, mahana ki a koutou katoa tangi tūrawa. It's really fabulous to be here today and to see all the participants and to be able to have this conversation. Thanks very much for all this work. And I have to start, as others have, as you have, as Miranda has, to say, the stark inequities are no surprise, but just because they're not a surprise, that means that we shouldn't discuss them further. I think that it's really useful for studies, and particularly for growing up in New Zealand, to be able to highlight those stark inequities, not just in one system, so in the housing system, but also, as Molly and Kate have described, in poverty and in socioeconomic status, as other growing up in New Zealand reports have recently shown, in education system, in the health system. And so from, some of my community organisation hats, I think it's important for us to continue to have these discussions about those inequities because of our Te Tiriti obligations, because of the obligations in the United Nations Declaration of the Rights of the Child, but also because of our moral and social justice obligations. But then to recognise that those inequities don't occur in silos for these young people, and the amazing, innovative, fantastic work that happens at the community organisation level doesn't occur in silos. And so some of our solutions to these inequities, which are by definition avoidable, so we can do something about it. Some of those solutions are about using this kind of evidence that looks across the sectors to drive the across-sector community. I'm happy with what I was saying. So I think I also would like to recognise that opportunity that we have in this data to connect across to what's meaningful, and where those real gems are, where those diamonds are that are looking at those cross-sectoral solutions. And I think it's also really important to hear again in this presentation today some of the stories of our young people that we actually just can't get in any other data source or any other meaningful way at this population level. It's actually really hard to find information about children and young people in the housing system, for example. And it's also really hard, and we don't understand the reasons for residential mobility. So being able to look at those, potentially voluntary versus involuntary moves, and the association with involuntary move and an experience of severe housing deprivation or homelessness, we can't connect those dots in any other data source. And we can't look at how that changes over time. So absolutely, Miranda, there are some real positive stories in here, but those are positive stories because we're able to follow the same young people over time. So then we can look at exactly what those influences are for those positive outcomes, as well as continue to highlight the solutions that we need to have for the adverse outcomes and the inequities that we see. So those are a couple of things that we're worth discussing. And I'll let others speak.
Elder Holly, I'm going to pick up on one of your points around connecting the dots and being able to bring different papers and pieces of evidence that have been created by growing up in New Zealand to understand the fuller picture, but more importantly to understand the places and time points in which we can all be doing better to support tamariki and rangatahi. And Kate, if it's okay, if I come over to you, I know you've done a lot of really interesting pieces of work with the Growing Up in New Zealand data set, looking broadly at these issues around hardship and disadvantage, and wonder, how you are starting to see this fuller picture emerge across the children's life. And as we head into this early adolescence phase, what is the picture you're seeing through this data set and other work?
Yeah, sure. This is a really good question. Because I think that we're now getting a large body of growing up in New Zealand evidence that is looking at these longitudinal trajectories of these different, what we call resource experiences, right? Like access to stable housing, access to high quality housing, not being a material hardship, having high enough incomes to, be able to meet your necessary needs. And what we've found in some of our prior studies, which Sarah Jane and Polly are also co-authors on, is that we're looking, and following again on what Molly was talking about before, even though children aren't necessarily sitting in these persistent stages of disadvantage, what we've seen is that even sort of an experience of one wave or two waves is still associated with, lower socio-emotional development at the 8-year and the 12-year wave, right? So we know that even these short experiences, it can be negatively associated with how kids are doing and their well-being, right? And so what this points to me, and sort of how I'm thinking about like what we really need to start thinking more carefully about from a research and policy perspective, is exactly what Polly's saying, is leveraging these data to understand what are the triggers into these states, right? Prevention is extremely important. And by having this rich data set that is looking across all these, these different, I call them triggers, into these experiences, the things that we, know from the really wonderful, qualitatively rich lived experience studies that have been done that we now capturing growing up in New Zealand, we can look at those at a holistic way and sort of play off them and see, is it the multiple triggers? Is it something that breaks the straw that breaks the camel's back? Does it have to be cumulative things, or is it one big thing that, might drop families into more hardship than others? So I think sort of the next step is thinking about those preventative measures, in particular, if we aren't doing a broader policy evaluation as our policies are being rolled out.
Elder Kate. Miranda, I might come back to you then, and sort of now we're thinking about the bigger picture, about the life course, about how these experiences of housing quality issues and homelessness, how material hardship plays out in particular ways. I wonder if you are able to share how you are starting to imagine the opportunities for policy. Is it a strengthening of policies or programs that are currently underway, or actually some new ideas that could be activated through a policy space, building on growing up research, but also a range of other research that's happening in other areas?
Yeah, so there's a lot going on in this space. We know that the housing situation for rangatahi experiencing homelessness is untenable. In the 3 months to March, over 50 16 and 17-year-olds had received an emergency housing special needs grant. Nearly 150 18 and 19-year-olds had, and nearly half the people in emergency housing special needs grants are children. That's nearly 3,500 of them. So this is a big problem. We don't want anyone to have to live in transitional or emergency housing. However, we need to make sure whānau and children are sheltered, whānau and young people. And for me, what I think this study offers is it's collected, they made sure at the beginning of the study that there were large enough samples of Māori and Pacific children, whānau being included. So it offers the opportunity to look at the wider needs of these young people, and that can help inform work that in terms of supporting whānau who are in transitional housing and other similar accommodation. So it can help us to and our partner agencies to understand where we should be focusing in terms of education and health and culture and the wider needs. There's so much data collected in this study that can help understand those more broad needs, and make sure that any negative impacts of this homelessness experience are short-term. And as well as the fact that it's a longitudinal study, so being able to go back to these whānau in future and see what impacts there have been in terms of their wellbeing more broadly. Yeah, there's a lot there in terms of that homelessness experience. And the homelessness action plan, which you mentioned, Kate, that has agencies involved across the board. So there's, you know, oranga tamariki, health, kāinga ora, police, there's agencies across the board. So it's about us understanding that full picture, that and this study provides that data to be able to explore that and help make sure that, you know, it's not just a roof over their head, but actually, you know, supporting more widely. Yeah, so another thing is the healthy home stuff. So just a little bit of a boost here is that it's studies like this study and other studies like this that help to make a change. So we have the healthy home standards. We also have the new builds that are happening, and yeah, a lot of landlords are now complying or close to complying with those standards. So really hoping that you know, in the next wave, we're going to see some more change in those figures. But yeah, and the data on involuntary moves and on residential mobility, that also we've got changes that have been made to the Residential Tenancies Act, and it's analysis and of this data that helps to make sure we've got the evidence there that embeds those changes and makes sure that that they're retained and improves them if they need to be improved as well. And there was a comment about policy evaluation. We do that. So we have an evidence and data technical working group as part of the Homelessness Action Plan, and there's lots of fantastic people contributing in that space, yeah, evaluation happening of the various interventions that are part of that that strategy. Kia ora.
Well done, Miranda. That was really interesting. Thank you for the sort of sharing how you see that, as you say, the data really having a level of influence in supporting policies that are going to make a difference for whānau. Polly, I wondered in your previous comments about looking for the gems again. I know you're involved in so many different spheres, policy, you know, your clinical work, but I am really interested in the work that you do with young people in the community, and I don't know if you've got any examples of where young people are actually coming up with solutions. So we need to be able to share data to support young people and their communities to put solutions in place that they know are going to work well for them. Do you see any of that happening now, and are you able to share?
Kia ora. Yeah, absolutely. One example that springs to mind is just fostering our young people to have aspirations and to be supported to achieve those aspirations. And, you know, for example, some work that we've done here with young people in the Waikato experiencing severe housing deprivation demonstrated that despite the context for some of our Pacific young people, you know, their goals and their aspirations are really strong. And so then having community organisations and government organisations that are able to provide them with that opportunity to see a path towards those aspirations and to foster that success is certainly not only fantastic for those young people and their families, but it's also really cost effective to harness these solutions and to reach towards these aspirations. You know, I think one of the things that this work tells us is that we really do need to be courageous, and also some of this stuff needs to happen with quite a lot of urgency. Even though we might say, well, you know, there was over 300 in this cohort that were experiencing severe housing deprivation, and only a small proportion of those were in situations like emergency housing. We know how expensive that emergency housing provision is. And then also we haven't yet costed out the ongoing impact of the environment of emergency housing for those young people over time. And there's some questions about the relationship between these inequities and educational attainment and other things. And we know that there absolutely is that association. So we're spending a lot of money in this space. But yeah, I do think that there are some fabulous solution-based, aspirational-based, and those aspirations often are associated with their housing environment, particularly, like, yes, absolutely, I want to own my own home. But those are also aspirations around identity, mana whenua connections, for example, around educational attainment, and around all of those other, supporting my younger siblings, or being engaged in my community and other aspects of life for me and my whānau. And again, those things are all connected. So if we can achieve aspirations in education, then obviously that's going to impact on our ability to navigate the really complicated systems that we have, and systemic failure is absolutely a challenge to achieve in those other areas. And we don't showcase those exemplars of success often enough. Hold up.
Elder Polly, thank you. I really appreciate your kōrero there about supporting young people to see forward and to look forward for a vision that they are creating for themselves, rather than necessarily back here trying to fix a system that wasn't designed for them and is not necessarily supporting them. So I think that's a great way to think about the tension and the role of enabling young people and ensuring their voices are being heard in the data set, but also for those of us with positions of power and influence to take on the challenge so that they can focus on their futures and their communities and whānau. Kia ora. Kia ora, Hugh. I want to just welcome you back into the panel. And we've been having a great conversation here, but I do want to give you the opportunity to share a little, please, about what you see in these papers. I've asked your colleagues if there was anything that surprised them, so you maybe something surprised you or inspired you in the paper, but please do go on to let us know how you see evidence such as this creating important opportunities for policy and for Aotearoa. Thank you.
Look, thank you so much, Sarah Jane, and thank you to the Gwyn's team for inviting me along, and thank you to the authors for preparing these terrific pieces of work. They really are very important. I'll limit my comments today to the material hardship work that Molly presented, and I just want to sort of give a big shout out, because I do think this is crucially important data for giving us really the only contemporary glimpse that we've got around the dynamics of material hardship, so the persistence and change in material hardship. And that's really important from a policy perspective. And one of the, we know that persistent material hardship and persistent poverty is really linked to much worse longer term outcomes, but it's fiendishly difficult to measure. Under the Child Poverty Reduction Act, there's an intention to establish a child poverty persistence target, but that's actually been postponed because it really hasn't been possible to measure that with the cross-sectional household economic survey. But from 2025-26 onwards, we will need to be setting, Stats NZ will need to report on persistent poverty, and by December next year, we'll need to have set a persistent poverty target. Now, Stats NZ hasn't determined what they're going to use as the basis for their measure of persistent poverty. It might be persistent material hardship, it might be persistent income poverty, we don't know. But the key thing is we don't have contemporary data that tells us about, what's the prevalence of persistent poverty. And I know that there's some other work that Kate and Molly and others are doing, looking at some of the antecedents and consequences of persistence, which I think is really important from a policy perspective. So that's just a big shout out. That's what I think is the terrific value add here. A couple of other things I'll just very briefly note. One of the surprises for me actually is that the cross-sectional estimates of the prevalence of poverty are actually remarkably similar to the cross-sectional estimates that we get from the Household Economic Survey. And that's kind of surprising because it's a very different cohort. So, the Household Economic Survey looks at 0 to 17-year-olds at a particular point in time. It's a sort of nationally representative. It's got slightly different demographic composition, but it estimates that around 10.3%, well, in 2022, but 10.3% of children lived in households experiencing material hardship. Having said that, obviously, it is really important that people are aware that the best tool for the job for having robust cross-sectional estimates will always be the Household Economic Survey. So that's your go-to resource for that. The growing up in New Zealand is incredibly valuable, but it's a different tool. So just bearing that in mind. And the third sort of related point is just to bear in mind aggregate time trends that are going on and that we can see in the HES time series. So it's really important for people to remember that we do know that rates of material hardship have come down quite markedly over the past decade. They've approximately halved, and that's been true for all demographic groups, so including Pacific and Māori. There's been a 23% reduction overall in rates, equivalent to 3.0 percentage points since 2018. So we just need to keep that in mind, that there have been some very significant, multi-billion-dollar investments in reducing child poverty. And so some of the findings that you see here in terms of, for example, the finding that 3/4 of those who'd experienced at least one instance of material hardship faced their first instance before they started school. There's going to be a bit of a cohort effect, because for children who were born since 2018 and Best Start, the very big increases to income support through the main benefit system, changes to accommodation supplement and so on, it may be quite a different story. It's just important context to keep in mind when you're sort of interpreting the findings here. But look, overall, well done again to the team for really important piece of work. Thank you.
Elder Hugh, appreciate that and your sort of signalling of the different areas where policy is in place to support young people and their whānau. And you actually picked up on a couple of points we were discussing earlier with the panelists about how we essentially connect all the dots from a evidence and research point of view with the wide-ranging policies and interventions that are in place. And yes, this idea that we are able, and Molly and Kate in their papers have really helped us understand those dynamics that you pointed to, and we hope that people will engage with some of the other papers that have come through the Now We Are 12 series, where we've tried to showcase the strength that growing up in New Zealand provides to the sort of broader data environment here in Aotearoa. Look, I think it's been great to see the questions come through the Q&A chat this morning. I think we've had people answering most of them. I suppose what I want to do to sort of round out the panel is to ask everyone, Polly, Miranda, Kate and Hugh, maybe just to finish us off before I close down the webinar, can you share something? What are you hopeful for the future for rangatahi wellbeing, whānau wellbeing? Polly, what are your hopes for the future?
Thanks for coming to me first for that one, Sarah Jane. Yeah, I have high hopes. I have high hopes that we all live in a society where our young people are recognised for the important contribution that they make, and that they are enabled in a just, racism-free, pro-equity space to live out their dreams and aspirations, being supported not only by the community organisations that are just doing amazing things on the smell of an oily rag, but also by a crown that allows those community organisations with their trusted relationships, with their integral knowledge, to be resourced appropriately, then hands off the table to commission for those successful outcomes that are driven by those young people. Hilda.
Hilda, Polly, beautiful. Miranda, what are your hopes for the future for young people in whānau?
He kāinga ora, he hapori ora. So thriving communities where everyone has a place to call home. And I guess my challenge to people is to consider focusing in on Māori and Pacific children, so that we can learn from them and their experiences. Those are the whānau that we can see are most affected right now, and the work that we can do, the research that we can learn from to help support these whānau is going to be critical. Hilda.
Hilda, Miranda. Kate, do you have a hope you'd like to share for the future?
Yeah, I mean, interacting with the young people at university, I see a generation that is committed to justice, that wants the environment to survive and have a planet to live on, and has a strong commitment to doing that above all else. And so my hope is that that there is some intergenerational justice and sharing of that responsibility, and that we can create that world for them.
Hilda, Kate, and finally Hugh, your hopes for the future.
So my hopes for the future are really that we sort of continue on this pathway of having this sort of societal focus on the power of child poverty reduction. I kind of would say that, but, given where I come from, but I think one of the really exciting things that we're seeing in the data is that child poverty is not an inevitability. We've seen some really sort of astonishing reductions in child poverty rates at the lowest levels over the past couple of years that they've been for the past 10 to 15 years for which we've got comparable data. There's a long way still to go to achieve the 10-year child poverty reduction targets, but there is bipartisan consensus on the Child Poverty Reduction Act. And I think, it's sort of exciting to be here at a time when there's this collective focus on the change that can be made. And I don't want people to rest on their laurels, but I think the progress that has been made is encouraging and is a sort of useful spur for further action and continued action. So I think that's probably my hope for the future.
Kia ora, Hugh, and kia ora, everyone. Again, just want to really thank Molly and Kate for their presentations today, and mihi to Polly, Miranda, and Hugh for being on our panel, for engaging in a conversation, and for sharing those hopes. And I hope that we all leave this webinar holding on to those ideas about the rights of children and young people to live full and flourishing lives, whatever that looks like for them, and that as a society we're going to help enable that to happen. So thank you for your time today. I want to thank everyone who's been on the webinar with us for this hour. If you are interested in the work that we've been doing here at Growing Up in New Zealand, and particularly in the Now We Are 12 series, please do register for our webinars. Our next webinar is due to be held next Wednesday, the 7th of June, where we're going to be thinking and talking about food insecurity and school engagement with the Growing Up in New Zealand cohort. And then just finally from me to remind you that the Growing Up in New Zealand data from before birth through to 12 years of age is available for all of your work. It is available for your ideas, and it is available for your research policy and advocacy. So if you're interested in understanding how you can get access to the Growing Up in New Zealand data, please visit our website. We'll be hosting a data workshop later in June, where you can learn a bit about the process to access that data set. And the 12-year data will be available from that time. And so finally, again, my thanks for everyone's time today, and in particular, our thanks and gratitude to the more than 6,000 whānau who back in 2009, 2010 shared their hopes for Aotearoa, which was that this country was going to be a good and safe place for their children, and that those children were going to be able to live full and healthy lives. So thank you all for your time. Mauri ora, kia tātou katoa.
Well done.
Ka kite.